Hi everyone, I'm Danielle Matias here at Caring Medical, Florida. I have a special guest today, Dr. Hauser, our medical director, helping me to talk about text neck. So many of you have maybe heard of that, but this is what I see all the time. People they're like, this is where my pain is. Probably you listening, that is where your pain is, right? It's right here at the base of the neck where that thoracic spine starts, and that's the area that gets kind of the most force when we're on our phones, on our tablets, on our computers, on all of our technology, right through here. I say this a lot, and I think you do too. Like our heads are like a big bowling ball, right? With this big bowling ball head that's sitting on our neck. And when it's in really good position, we're built to be able to handle that force, right? Yeah. When you're looking down on your phone, I'm going to say phone, we're talking about text neck, but it could be anything. All of that extra force is then transmitted to the rest of your spine, and one of the biggest areas that gets the brunt of it is right here, base of the neck, again, that cervical thoracic area.
When you're in this position all day, and of course, we admire this person for looking at the right thing on the computer, right? You know, the Caring Medical website. Yeah. But you stretch all these ligaments, and then we've talked about this before, but what's creep?
Creep is the time elongation of ligaments, right? It's very slow. It doesn't mean that like looking like this for 3 hours is all of a sudden going to give you severe instability, but do it 10 hours a day, 7 days a week. Over time, those ligaments get stretched. And I remember when I started working with you, a decade ago or more, I remember you said the future of prolotherapy is the neck. And I was like, okay, he says a lot of things. File that away. This is so much of what we see now is people with neck injuries and thoracic injuries and maybe even some shoulder stuff in there too from using a lot of technology.
Yeah, the sad part is, and we with other videos, is everything that goes into the brain from the body goes through the neck. So it's like the highway. Yeah. And having instability here, it's like that car crash on the highway, and now everybody has to go to the really small streets, and it's like a disaster. So this is affecting, just not just pain, but it's actually affecting the brain and the body and the health of the brain and the body.
Absolutely. Next, we're going to show actually a 3D animation of what we're talking about.
Yep, that's everybody just working on the computer.
Forward head posture, like your head's kind of slunked in front here. Oh, and a cell phone.
The hours go by. Yep. Hours go by. Then this is one of my favorite videos we've ever made. Like, watch this, how it goes in. What's really happening?
So these are the vertebrae in your neck. These right here, these are facet joints. Okay, they're held together by what's called a capsular ligament.
Yeah, when they're all getting stretched out, they're just getting stretched out.
Yeah, here's an example. So hunched over computers, computer on your lap, computer on a low table, hunched over, that's going to increase that strain all along here. We're talking about pain, right, with text neck and causing pain and ligamentous instability, but it really can cause more than that, right? You can actually start to get dizzy. You can start to get pain in your shoulders and even your upper to lower back. Weakness. You're stretching out these muscles are tight. Maybe there's not a good balance from other weaknesses there too. Headaches. I mean, this is I would say probably besides neck pain, probably the more common thing, right, is headaches. Yeah. And it's just like perpetual slouch. Like then we see you walking on the street, slouched over. When somebody has a ligament injury, right, like that ligament, that tight rubber band is now stretched out, kind of floppy and loose, when those segments in the neck, thoracic spine can't be held together and start to move more than they should, I mean, it's like this huge laundry list, right, of all things that can happen. Drop attacks, fullness in your ear, vertigo, ringing in your ears, things that we'll see on imaging, degenerative disc disease, bone marrow edema, all of that. Really, the list goes on and on.
What percentage of the people that you see would you say that they say they have clicking, popping, grinding in the neck? Do the most of the people have it, or?
Yeah, I would say, yeah.
Because that's what I find too. So in essence, when I say to them, I'm like, Joe, like my neck doesn't click and pop. Intuitively we know your neck isn't supposed to click and pop. Like you could say, well, I got a little clicking and popping in the knee. Yeah. Well, yeah, the knee's in a groove. There's a groove and it's off a little bit. Or occasionally, you sleep wrong and your jaw clicks a real little bit. But your neck, all the vital things of the whole body, the vagus nerve, the jugular vein, the spinal cord, the cerebral spinal fluid, all the things that bring all the information to your brain. You don't want that thing being loose. Like, that's a really serious thing. And then it's amazing the design of the neck, how the vertebral arteries groove their way inside the vertebrae.
Yeah.
So you do not want that thing being loose and then kinking your vertebral artery to give drop attacks. And I don't know if it's people manipulate themselves more or it's just hours and hours and hours. Like, I had a teacher, very affluent high school. She was a vocational counselor there. And she said to me, she said, the first thing I do when the kids come in for vocational counseling, you know, what courses should I take in high school because I want to be a nurse or a doctor, or they have to give her the cell phone. And she goes to me, she says, Doc, guess what I see on their average screen time on their cell phone?
Oh, gosh, I don't even want to know.
So I said, what, 6 hours? She goes 10 to 14. So it means that during school, your child or the children, you understand, during school, because you can't, how could you get 10 to 14 hours if you're in school for 7 hours?
Yeah.
That means all during school. So can you imagine your loosey-goosey, loose-jointed kid, teenager, and 10 to, you know how much time that is?
Yeah.
10 to 14 hours, and you just fret for these kids, like what's going to happen when they're 22 or 21? And almost all of them are now on medications. They're on some kind of medication. And it's almost always medications related to this. Like ADD can be related to this. Brain fog's related to this. Personality changes is related to this. Migraine headaches. Hormone problems. What's the central commander that tells the body you got to make more hormones or less hormones? It's your brain. It's all in the hypothalamus pituitary gland. So this is a really, really serious problem. So we talk about, because Tech's neck, it has, I got a little bit of pain.
Sure.
But it can be a really big problem.
Or that's where it starts, you know? It's like, and so if someone is overall pretty healthy and they don't have all those autonomic symptoms, but like, gosh, I know I'm on my cell phone too much, I'm starting to get pain here, maybe I'm starting to get that little kind of hump, you know, that we see a lot. Things are easier to be reversed when you catch them early,
That's a good
right?
point.
You know, so doesn't mean that people have to wait to seek treatment until they start having drop attacks, right? I mean, that's pretty scary. But once you're like, gosh, I'm starting to get pain, I'm on my phone too much, it's not going away, it's getting worse, or, you know, I used to get pain at the end of the workday, now I'm starting to get it at lunchtime, you know, being hunched over. Listen to these cues that your body is giving you, because this is a progressive thing. This does not get better unless you actively work to change it.
You know, we would say migraine headaches whoop-de-doo. But really, should a 14-year-old be on migraine medication? Like, so you're saying to me, for the next 76 years, if they live to be 90, that's how you should treat it? It's not a good idea. It's not a good idea.
Yeah, these are really serious. You know, we see things more compromising to life, you know, the migraine headaches. But even at the end of the day, like, nobody wants that. Nobody, you know what I mean? Like, to have to sit in a dark room for 3 days, and they're awful. This is just snippets from a digital motion x-ray, we call it DMX, of the neck. So this is the person right here in neutral. Let's just talk about that, because a normal cervical spine should be this kind of like C shape, right? Look at this, it's like straight and forward. And if you look here, here's C1, 2, 3, 4. So starting at 4, it's like this kind of upside down stair step right here, where these vertebrae, you can even see it on this side, they're offset. So even in a neutral position where you're standing and not doing anything, this person already has abnormal alignment. And then when they flex or look down, you know, it's worse. More exaggerated here again, this stair step in that lower cervical spine. And then here, if we look at extension, and this is actually kind of looks more like a normal-ish curve, right? This is beautiful. Yeah. You know, you see how you have this jagged kind of lightning bolt line, and this is this beautiful arc, right? So one of the most common things that we see, where inflection, their instability, when you're leaning down is worse, and then when they extend and kind of mimic a better curve or a normal curve, it looks better. I
just want to make one other point. The space here in front here is very narrow. The space in here is plenty. Long story short, so we have these models in the room, so you can kind of see right in front here, there's a lot of space. So obviously, if the person's curve wasn't this, but it was the opposite, you know what I mean? It's going to narrow. So unfortunately, what's here is the jugular vein, And what's also here is the vagus nerve. So the vagus nerves innervate everything, the heart, the lungs, the pancreas, the gallbladder, the liver, the stomach, the digestive tract. So everything related to digestion is vagus driven. And then, of course, the jugular veins is what drains the brain. So if the brain can't drain, the brain pressure is going to get high, toxins are going to accumulate in the brain. Then, of course, the person has brain fog. They can't concentrate. They might even get mental health issues. We're seeing more and more mental health issues.
Right here is like all those vital structures are getting pinched, where here they have a lot more area to breathe.
For that, yeah.
This is another part of the DMX, the digital motion x-ray, looking at C1, C2. So this right here, this is the outline or the end of C1, and then here's C2, and they should be on top of each other. Like, they should actually be in line, but you see here there's a 7.1 millimeter difference. I mean, that is very significant. That is a severe case.
Yeah.
So we've talked a lot about cell phones, right? Like looking down at cell phones or any kind of technology or what are ways that we can actively work to fix that, right? Because cell phones are not going anywhere. They're going to be a part of our life forever. So how do we, just for our own health, work on minimizing the time looking down? Well, there's several different things, right? So this is, thank you for being this beautiful model here. This is Dr. Hauser's desk, where you can see he's not looking down on his computer. It's not on his lap. He's looking forward and up. These are prism glasses. So these are actually really cool. And so they're actually, like, you can see he's holding a book here. By wearing those, he doesn't have to look down to read it. He can actually look forward, keep his neck in a more neutral place, and be able to read. There's this funky design there for looking at cell phones, laying on your stomach. You know, we've talked about that in another video. All ways that we can reduce the strain on our neck. Simple changes can sometimes just really reduce that on its own, right? Or if somebody is undergoing prolotherapy and we're trying to tighten these ligaments, you know, you're not going to do yourself any favors staying hunched over all the time while we're trying to tighten this and bring it back. So making these changes on your own before or when starting prolotherapy can really, really have a big impact.
I liked what you said in another video. You said your children.
This is what I make my kids do.
The kids are going to get a hold of tablets, or sometimes you just got to entertain the kids. But at least have them, because you still have to use your neck muscles in that position. And
my kids are young. You know, I don't have school-age kids yet, but when they want to watch things, either if it's not on the TV or they want to watch a video on my phone because I need like 5 minutes, right? Yeah. Then they have to lay down. That's the rule. So this is actually a video of a neck treatment. So here's the patient. We've got ultrasound. The needle's coming down the middle, treating all the facet joints. That's the main target here in this patient here. Yep. So you can see, you know, we've talked a lot about vital structures in the neck that when compressed can cause issues. Obviously, with treatment, you know, we're being safe avoiding those vital structures.
If somebody just has pain and they come to you, like, you know, before they get all the neurologic things, it's mostly just pain. How many visits normally is it with prolotherapy? And then how often do you see the people for prolotherapy?
That's an interesting question, because I see a lot of people, right, that just have neck pain and that's their only cause, and then we do their testing and we're like, oh my gosh, like you're on the verge. Like there's, you know, like you've got a lot of neurologic things.
There's neurologic things that are probably going to happen if you don't do something.
Right. Typically though, I would still say treatment about every 4 to 6 weeks, you know, kind of give or take. And then I would say on average in my practice for necks, I would say it's probably about like 5 or 6.
Okay.
On average.
And if somebody has a lot of neurologic things, then anything could, you know, it could be 10, 12.
Right, it could be a lot more.
Yeah, it could be a lot more.